Hello shade lovers, welcome to another episode on Toxic Tuesday. On today's episode we'll be focusing on dental fluorosis in children. Yeah, we've already spoken about those of adults and or the general perception or overview of dental fluorosis. So on today's episode, as we are focusing on the children, I have to clarify that dental fluorosis in children is different from that of the adult because they've got different biology. But this is where it's extremely important for especially parents so that they could really know how to help protect the dental or the permanent teeth of their children. So this is to say that once their biology and all that is different from the adults, from this stage in the children, that is where their permanent teeth is forming silently, and it needs to be protected within this window where I will call it, or we normally call it as the critical window or critical period. Now let me go on to why children are vulnerable when it comes to dental fluorosis. Children are vulnerable because dental fluorosis at this point with this critical window from around 6 months, about 6 months to around 8 years. This is where we call the critical window, where their permanent teeth is silently developing beneath the gums. And what happens is within this age range or this phase, critical window, the teeth or the enamel is soft and is actively mineralizing. Basically what it means is that it's forming these protective the strong or hard enamel due to presence of fluoride and all that, where your fluoride forms combines with the hydroxyapatite to form fluoroapatite, which is the hard it creates a chemical or the nature of the enamel that is hard, that is able to resist tooth decay, help with tooth decay and bacterial infection and all that. That's what it helps. But however, within this critical window or period, when the fluoride is in excess, it affects how the enamel forms and how it appears. When this happens in the children, the excess fluoride would make the enamel look uneven or porous. This is because the amount of fluoride that is taken from several sources. First, it's got to do with the toothpaste, your borehole or drinking or tap water or well water, or from fluoride supplement. All of this accumulates over the time, and when it accumulates and it damages the permanent teeth that is silently or quietly forming beneath the gum, it becomes permanent within this critical window period. This is why children are vulnerable when it comes to dental fluorosis. Now let's go on to the next part. What are the signs or the things that parents could do to determine or to be able to take notice that my child is progressing or developing dental fluorosis? First on the list has got to do with the fact that the dental fluorosis, when it's occurring in children, is very silent, and most parents end up missing these signs. Let me begin with the first on the list. Has got to do with the child, or in children that are affected by dental fluorosis, they begin losing their natural white, bright, shiny teeth. They have a dull or matte appearance of the teeth, and also they have some streaks on the teeth, which I would say chalky white blotches. And once these are presenting in there, if it's not noticed, it could progress onto the serious forms of dental fluorosis, where the child's teeth become yellow or brown, or if it gets to that stage, the next thing it could be that it becomes pitted or rough. They have pitted or rough enamel. So these are the signs and symptoms that could be seen in children that are developing dental fluorosis. And it will be once these things, because when it happens, these are not stains, but they are telling us how the enamel has been formed or has been influenced by excess fluoride. I'm going to continue with the last part. Thank you, shade lovers. Hello shade lovers, welcome to the final part on dental fluorosis in children. I've already spoken about why children are most vulnerable when it comes to dental fluorosis, the signs and symptoms of what parents have to watch out for. On the final part is how we could manage, or what are the things that we could do to avert these kind of situations happening in our children. What happens in here is the fact that first on the list, we've got to keep in mind that we have to use children from 0 to 3 years. We have to use a grain size of toothpaste, or grain size amount of toothpaste for brushing their teeth. Basically, when you use larger amount, these children end up swallowing almost 80 or 90 or whichever percentage, but they swallow most of these toothpaste. And this brings us to the fact that the technique that is used in brushing is not as important as with regards to the amount or the size of toothpaste that we use in the children, and that's very, very important. The next on the list is got to do with the fact that we shouldn't over brush the teeth of these children. Some may think that over brushing the teeth of the children is about protection, but no, that's not what it actually is. It's actually increasing our risk of exposing the children to more fluoride, which could precipitate or cause these dental fluorosis to heighten. The next on the list is we've got to know our water sources, our tap water, well water, borehole water, bottled water, whichever source, or our local sort of water. We should try, if possible, get to check the fluoride levels before giving these to our children if they are within the range. For more information or for more clarity on the fluoride requirements in adults or in children, I've already explained that in my previous videos. The next on the list is got to do with the fact that we should also be careful of not supplementing or giving fluoride supplements unnecessarily, because rarely do children need fluoride supplement unless it's advised or recommended by a specialist. Then that's fine. But aside that, we shouldn't self-prescribe or give them to our children. The next on the list has got to do with that we should really be careful with the kind of water we use for our children. Basically, some of this water, the example, mixing children or infant formula for the toddlers and the children, their formula with tap water or other sources of water that contains high levels of fluoride, which could also cause this dental fluorosis. Last but not the least is also the fact that we should have a dental review, because dentists would be able to tell when these fluorosis are beginning, or when they're whichever stage it is. They could review and tell, and early detection could also help give the right treatment. So to wrap up on dental fluorosis in children, it's not about blame, but it's about awareness and education, because the right amount of fluoride in the children's system through whichever sources helps strengthen their teeth. But however, if it becomes excess, it rather causes harm to the teeth. Thank you, shade lovers. See you next week.